In this video, we're going to show you how to score highly in conciseness and clarity in the OET writing. So keep watching. Let's check it out. Hi, I'm Jo from SLC, here to help you pass your OET exam. In this video, we're going to take a look at conciseness and clarity. We will look at what the descriptors of this criterion actually mean and tips for how to improve in this area. So let's take a look. You will be assessed on 6 criteria. Purpose is scored out of 3 and all the rest have a maximum of 7. You can find a downloadable copy of this writing criteria on the OET website. It's a good idea to use the descriptors for Band 7 to find out exactly what you have to do to score highly in this area. So for conciseness and clarity, you need to make sure that your letter is not too long and not too short, that you have not included information that the reader does not need to know, and you also need to summarize the relevant information in a clear way without using long sentences and unnecessary words. And the ideas expressed in your letter should be easy to follow. So what does this mean for you and what you write in your OET letter? First in the descriptors is length. The task states that your letter should be 180 to 200 words, but this limit is a guide only. If you have written much more than 200 words, this is probably an indicator that you have included irrelevant details or that you haven't summarized the key information effectively. And if your letter is very short, it probably means you've left out some important information. Know your handwriting before the exam. You don't have time to count the number of words you have written in the exam, so make sure you know what approximately 200 words looks like in your handwriting. There is no set number of paragraphs, but a rough guide would be to write 3 to 5 paragraphs depending on the content, and ensure that they are not too long. Keep the focus of the letter in mind when writing. Think about it in this way. If the focus of the letter is post-discharge care, and there's a lot of information regarding this, then it probably means that other information, such as hospital treatment, should be summarized more concisely, with less focus. You need to make sure that irrelevant information is not included. This is important as it can distract the reader from important information and what they need to do. Here we have an excerpt from some case notes about a patient who has undergone a hip replacement following a fall. Look at the extract from a letter relating to these case notes. Mr. Smith underwent an appendectomy in 1985 and a total left hip replacement in 2014. He also has hypertension and takes Ramipril 10 milligrams daily. What do you think? Relevant? No. This is irrelevant and should not be included in the letter. This information is not needed for continued care, and this is what you need to ask yourself when deciding what information to include. Does the reader need to know this in order to fulfill the purpose of the letter? And if the answer is no, don't include it. Summarizing effectively is an important part of conciseness and clarity. You need to summarize the case notes and the relevant information you have selected without going into too much detail, but still clearly communicating the key information. Take a look at this extract from some case notes. The patient has visited the GP 3 times with worsening symptoms, and these need to be summarized effectively for the reader. From the 2 examples here, which do you think is more effectively summarized and why? The first example provides a clear summary of the timeline of the symptoms, what they are, and what the current situation is. The reader would have the key information without needing to read the specific details about each visit. The second paragraph shows a lack of summarizing. Details are given of every visit and it overloads the reader, repeating the same symptoms over and over. The overall effect is distracting to the reader and also reduces the clarity of the letter. The reader only needs a brief summary of the deterioration and a focus on the current condition. This is particularly important when the urgency is higher. Think about it this way. If you were working in a hospital or a care home and you were doing a verbal handover to your colleague at the end of a shift, you wouldn't include every single little detail of what happened to the patient that day. You'd summarize the key information. Well, the OET writing is similar. Think of it as a sort of written handover. Let's take a look at another example. Take a look at these two examples. Which one do you think has been summarized more effectively? Well, the first paragraph doesn't summarize the information from hospital treatment. Details are given to the reader of every physiotherapy session and details of mobility that is no longer current. And these details distract from the patient's current situation, which is what you don't want to do. The second paragraph conveys the key information to the reader clearly without any unnecessary details. The final descriptor in this criterion is clarity, which simply means that the information you include must be expressed clearly and easy to follow by the reader. Take a look at this extract from some case notes. Now read these two paragraphs, requesting and informing the reader. Which paragraph do you think is clearer and easier to follow, and why? The first example lacks clarity and it's also vague in places. It says the assistance with ADLs might be needed, possibly raising questions or doubts for the reader. Well, is it needed or is it not? It also states that the patient will be wearing anti-embolic stockings rather than informing the reader that it's necessary. Information is also included that the patient will receive physiotherapy sessions at the home twice a week, which is correct, but it lacks clarity as the readers would have questions about how this is going to be organised. The second paragraph is written clearly and in a way that is easy to follow while still including the relevant and essential information. She will need to wear anti-embolic stockings. Assistance with daily activities will be needed. The physiotherapist will contact you regarding the sessions. After reading this paragraph, the reader would have a clear idea of what's going to happen. Now let's look at another extract from some case notes. Look at the two summaries on the right-hand side. Which one do you think is clearer and easier to follow? What do you think? That's right, the first example is better. It clearly expresses the timeline, the worsening symptoms, and also today's situation. Whereas the second example does not really provide a clear timeline for the symptoms, and is also a little vague by not giving the reading of the temperature. Top tips for conciseness and clarity. Check the length of your letter when practicing. It will act as a guide to prevent you from including irrelevant information and summarising ineffectively. It's really important to practice summarising and paraphrasing so that you can do this confidently in the exam. Also, when you are writing and when you are checking your work, ask yourself if you have only provided relevant information to the reader. Always remember, why are you writing? What do they need to know? So thanks for watching. Don't forget to subscribe to our YouTube channel for more videos like this. Click on the bell and you'll be notified every time we post a new video. Check out our website, the link's in the description box below, and see how we can help you with your OET preparation. Stay tuned for more videos like this. We've got loads of great tips and strategies coming up in this series, and see you next week. Bye! In this video, we're going to show you how to score highly in the conciseness and It's like this. It's the same, but I don't remember. Mr. Smith underwent an appendectomy. Mr. Smith underwent an I can't say. Mr. Smith underwent an sorry. Mr. Smith underwent an appendectomy. And then, so thanks for watching.
I'll just stop.